Hello guys, welcome to Ankit Sunyalvez. Today I'll tell you about 24 diseases which doctors or medicos may suffer from. In this video I'll be talking about the occupational hazard also, and the reference for the scientific data and medical facts provided in this video is given in the description box of this video. The first thing is stress. Doctors are exposed to high level of stress in their course of profession. In India itself, in a national survey, the prevalence of stress was up to 40% and even more. The stress was because of the doctors dealing with the illness, diseases, deaths of the patient. The stress was due to overload, excessive paperwork, demanding patients, and it was more in ICU and emergency department. Stress resulted into burnout. In a research study, it showed that almost all the department have around more than 50% of burnout. The burnout resulted into depression, anxiety, sleep disorder, fatigue, addictions, marital dysfunction. Depression was low compared to the general population. As the doctors have greater knowledge and better access to the lethal means, doctors and medicos have far higher suicidal completion rate because they have access to everything and they know how to use. Even among the MBBS students, the depression was around more than 50%. The next thing is obesity. In India, almost 50% of doctors were obese, and because most of the time they don't have time for the physical exercise, they have evening shift, night shift, they have poor diet and stress overeating. The next thing is diabetes. Diabetes prevalence was around 9 to 12% in Indian doctors. In an ambulatory BP check, Indian Medical Association found around 50% of physicians have uncontrolled hypertension. So this results into increased risk of coronary artery disease because of hypertension, hypercholesterol, and obesity. Apparently, in an observation study by Indian Medical Association, found out that almost all the doctors have around 10 years lesser compared to the general population in their lifespan, and the most common cause of death for the doctors were the cardiac arrest. Doctors may have impaired reproductive health because of stress, anxiety, radiation exposure, late night duties, late marriage, and obesity, diabetes. Doctors suffer from gastritis or GERD. There is improper food and sleep timing because of their duty. There is no time exactly when their duty will end. Some surgeries may go even beyond 24 hours. Doctors suffer from back pain, neck pain a lot because of long static posture and prolonged sitting, and especially if they have to work with microscope. It was found more in ophthalmologists, ENT surgeons. They may suffer from varicose vein. In varicose vein, there are veins of your legs which get dilated. It's because of prolonged working hours, especially more common in surgeons. Doctors may suffer from airborne infections from patients. Upper respiratory infection like cough and cold is very common because as doctors get exposed to patient a lot. TB is a serious issue. I personally have seen lot of residents getting tuberculosis during their residency time. Doctors generally acquire infections from hospitals with patients. Doctors may suffer from cellulitis. This was more common among the residents. Cellulitis is a skin infection. Doctors are more exposed to radiation, as we all know, because during the intraop, x-rays, fluoroscopes, doctors get exposed. As we all know, radiation have lot of harmful effect in your body. The next is brain tumors. This is little bit controversial, but still it was shown that interventional cardiologists and radiologists get more exposed to radiation, which can result into brain tumor. Needle prick injury or a cut from scalpel, this is more common among surgeons. This injury or cuts can transmit the disease like HIV, hepatitis B, hepatitis C, which is very dangerous. I personally have seen a lot of surgeons who got hepatitis B because in the emergency surgery sometimes doctors may not get that time to check even the status of the hepatitis B or C of the patient. They just directly jump in and do the surgery to save the patient. The next is noise induced hearing loss. That was seen in orthopedic staff because of machine and drilling noise, but now it have been reduced with new improved machines. The next is chemical injuries because of repetitive use of sanitizer, which results into dryness of skin. Doctors may get exposed to a lot of chemicals like disinfectants in hospitals. Mercury poisoning, splitting from the thermometer or BP machine which was there, but now new digital thermometer and the new machines, the incidents have come down. Doctors get exposed to a lot of gases, like most common among surgeon and anesthesiologists. This was even seen female anesthesiologists who get pregnant, and there were high rates of first trimester abortions due to nitrous oxide. Toxic air gases may result into respiratory irritation, cough. Doctors, especially the anesthesiologists and operation theater staff like nurses, technicians, they get vitamin D deficiency because most of the time they are not exposed to sun. They will go early morning to the operation theater and come out in evening or night. The next is workplace violence. As we all know, the violence against the doctors is going up, and it's causing a lot of problems for doctors because doctors may become handicapped and even death. They undergo a post-traumatic stress disorder, mental stress. There is injury, trauma. This is more common in emergency department. I would request, like, please stop violence against doctors. Doctors are already suffering from a lot of diseases and lot of things. They are sacrificing a lot. Please try to understand they are also human. These were the reference whatever I have used in my videos. You can go through. If you like my videos, do subscribe to my channel. Follow me on Facebook. Thank you guys for watching this video. See you guys in my next video. Tata, bye bye.